Hi, Karen here, posture alignment specialist, with a little video, a very short video, on breathing and pelvic floor activation. And if we're getting towards a certain age, or there have been babies being born and abounding, then you'll all know about your pelvic floor. There may be people with prolapses. You may have incontinence, or finding that you are going to the toilet more regularly and can't hold it as easily as you have done before. Well, the diaphragm is attached to the pelvic floor, and as most of us know, with posture and breathing, all those go together, but your diaphragm is connected to the pelvic floor. So we're going to do a bit of a breathing test in a second, and we're going to test that. So what I want you to do, whatever seat, if you're seated or you're standing or you're lying down, whatever it might be, I just want you to put your fingers to the front of your rib cage here and your thumb behind, and we're going to take a deep breath in and a breath out. I want you to feel in your hands what motion your rib cage is taking and where you feel it in your hands. Okay, so take a deep breath in and breathe out. Okay, where did you feel it? We're going to do it again, and I like to focus on a little bit more, because what you want to happen is for the diaphragm to work to push your rib cage sideways. So you should really feel the pressure on the inside, in between the thumb and the finger there, but also into your back ribs. And breathing into the back ribs is a really great thing to do, because it really opens up the rib cage. It can take pain away from your lumbar spine, your sacroiliac joint, and your neck and shoulders can be released just with back rib cage breathing. So great thing to do. Let's try that again and see. Focus on a little bit more and see where you feel it. Okay, did that feel a little bit better? Now, if you couldn't feel it going into the side or the back, then we need to make a little bit of extra work for you to be able to do that. If you felt it more in a lift, or from the chest, or your shoulders lifting, then that's an incorrect breathing pattern. And that can bring about pain from all sorts of different sources. Things like fibromyalgia and chronic pain syndrome, chronic fatigue syndrome, they all have links to incorrect breathing patterns. So because we take approximately 30,000 breaths a day, can you imagine 30,000 of incorrect breathing into places where we shouldn't be breathing, and having no connection to what's going on down here at all? So it's worth trying to get your head around that, especially if there are some issues with the body. Now, the pelvic floor muscles attach to two areas, and we want to try and think of them as a hammock, because they attach to your pubic bone and they attach to your tailbone. So if you think of that hammock underneath everything, now I'm only doing this for the ladies because it's a little bit different for the men, unless you've got a prostate issue, which is a different video altogether. So if you think of the three openings, your urethra, your vagina and your anus, what we don't want to do is concentrate on one thing. I know that there are techniques for stopping yourself in mid-flow to having a wee, and there's also the same with your anus as well, which is not a great thing to do, but that's all concentrating on one area. Really, your pelvic floor is a grid of muscle that needs to work together, not in separate pieces. It never works functionally as separate pieces, always works as that holding mechanism for all the internal stuff going on in here. People with prolapses will know all about that. So this time when we take a breath in, because when the pelvic floor because when the diaphragm is utilised, it connects the pelvic floor, it creates an intra-abdominal pressure. And we're going to feel that. And I want you to feel what the pelvic floor is doing within that intra-abdominal pressure. Because as we sit now, or stand, whatever you're doing, lying down, whatever it is, you shouldn't feel tight. You shouldn't feel contracted down there. Being tight all the time doesn't do us any good at all. So we need to feel the contraction and we need to feel the tightness, the release. So what I want to do now is when you breathe in, that's fine. When you breathe out, forcefully exhale the breath. And I want you to see if you can feel that intra-abdominal pressure and the tightness that creates in the pelvic floor. Let's give this a go. Okay, deep breath in. Forcefully out. Okay, did you feel a push down and a lift up? If you didn't, we need to get a grip on that as well. So let's try that again and see if you can feel the front and back hammock lift and close everything up, because that's what it should be doing. Okay, let's try again. Breath in and breath out. Okay, did you get it? It might need a bit more practice to be able to register what is actually happening here. So the breathing exercise to make sure that that pelvic floor is working properly with the diaphragm is now coming up. It's going to take you about 3 minutes. We're not going to do all 3 minutes now. I'm just going to show you the technique and then you can get on with it in your own time. So you're going to need either a yoga block or a cushion that's going to give you sort of that much of a pad to squeeze on, because you're just going to go in between your knees, or a ball, something like that. Okay? You're going to get yourself into a position where your knees are above your hips, which they aren't there on the knees, so I'm going to come forwards into the wall a little bit. And you need to have your feet flat on the floor, pointing dead straight ahead and in line with the hips. So the block or whatever it is goes there. If your head doesn't go flat on the floor, then please by all means put a small cushion underneath the head to give you a little bit more comfort. And if you feel here that your pelvis is tilted forward so much that you feel quite a bit of an arch in your lumbar spine here, so that you've got a quite gap between you and the floor, then I want you to just tilt the pelvis back, engage the hamstrings. You're going to press into the wall a little bit and just tilt the pelvis back so it's more neutral. Not that you're pushing into the floor, just so it's in a more neutral position, and hold that. Now your arms are out by your sides, a little away from the sides with the palms up, so your upper body is nice and relaxed. Now when we do this breathing technique in a second, what you're not going to do is a pelvic tilt, so there's going to be no movement through the pelvis, and you're not going to squeeze your bum muscles. So let me explain first. You're going to take a normal breath in, and on that breath in you should feel open. There should be no increase in tension down within the hammock area. And when you breathe out, on the exhale comes the exertion. So you're going to press quite heavily into whatever's between your knees, and you're going to lift and pull that hammock area up. Okay, and then we're just going to release and just breathe normally. So let's try that. So breath in, and on the breath out, squeeze, lift and pull. Feel all three areas squeezing and tightening and closing, and then release the knees and then just release. Do you feel the difference? Hopefully you do. Let's try that again. So breath in, make sure everything's released. Make sure you can feel your rib cage going sideways. You can put your hands there if you want to. And then big exhale, squeeze, lift and pull. All three areas of that hammock, all pulling in. Okay, your bum cheeks should be relaxed, and you shouldn't have tilted your pelvis in towards the floor. And just release. So let's try this one more time and I'll leave you to it. So a breath in, no tension at all through that hammock area. On the breath out, big exhale, squeeze the block, pull in and lift and tighten. You feel it in your lower tummy muscles, pressing the feet into the floor a little bit, pushing between your knees, tighten and release. all three areas, not one in particular. Okay, now if you do that regularly, hopefully every day, and you see a bit of a difference in your weeing activity or whatever, then great, it's working. But it's the contraction and the release that we need to feel, not either a tight contraction or no contraction at all. So it's worth doing and worth getting your head around until you can actually feel both of those. And once we know, and once you can feel that diaphragmatic breathing with your ribcage going sideways, then we know that connection is there and everything is working fine. All right, so it's a quick few minutes. I hope it works for you. Any questions?